I'm Judge Common Sense. Who do I have before me today?
My name is Dr. Deep Pockets. I'm here on behalf of the Medical Association. We are in opposition to legislation brought forth by the Physical Therapy Association.
What type of legislation are you opposing?
Physical therapists are attempting to treat patients without them first seeing a doctor.
Aren't some physical therapists doctors too?
Everyone thinks they are a doctor these days. Dentists, veterinarians, chiropractors, optometrists, podiatrists, audiologists, psychologists, and now physical therapists. The only real doctor is a medical physician.
Are you trying to tell me Martin Luther King Jr. was not a real doctor?
That's different. He did not work in healthcare. Patients might get confused when everyone calls themselves a doctor.
Are you trying to tell me that a patient does not know that a dentist won't be removing his appendix along with his molars? Or a patient will drop his britches at the audiologist's office expecting a prostate exam? Do you think the public is really that stupid?
Physical therapists are not real doctors. They do not practice medicine.
I do not think they are trying to practice medicine at all. Physical therapy is not a subspecialty of the medical profession, and physical therapists do not claim to be medical doctors. Physical therapy is a separate profession that provides a unique service that physicians are unable and untrained to provide. 2 PowerPoint slides during the first year of medical school does not cut it. Currently there are 212 accredited physical therapist programs in the United States. 96% culminate in their Doctor of Physical Therapy degree.
Any institution can spring up and offer a doctorate degree these days.
Actually, some of the most prestigious institutions of higher learning in this country, such as Columbia University, Duke University, and Washington University in St. Louis, offer the Doctor of Physical Therapy degree, something chiropractic and podiatry cannot claim.
They do not have adequate training. If physical therapists were allowed to see a patient without a medical referral, the public will be in great danger. Many people will die.
Now that is very serious, considering anyone can see a personal trainer, massage therapist, acupuncturist, or naturopath without medical referral. There is no public outcry over this ability. What type of evidence do you have to back this up?
They do not have the training. They might miss a sinister diagnosis such as infection, fractures, or even cancer.
Instruction in screening to determine when patients need further examination or consultation by a physical therapist or referral to another healthcare professional is required to be in the curriculum of every accredited U.S. physical therapy school.
They do not have the training.
The ability to perform a screen to determine the need for referral or for physical therapy services is part of the minimum required skills for physical therapist graduates at entry level.
They do not have the training.
Comparing the training of physical therapists and physicians is flawed, as it serves no purpose to compare the training and education of 2 distinct professions.
If a physical therapist was treating a patient with back pain, they will be unable to determine if it is caused by a large tumor.
And how would you determine this? Do you have X-ray vision, I suppose?
My license allows me to order blood work, diagnostic imaging, and even a biopsy that could detect cancer.
I certainly hope you are not ordering blood work and imaging on everyone who complains of back pain. You would be a horrible physician and a drain to the healthcare system if this was happening.
Physical therapists cannot detect cancer. Patients will die.
Physical therapists are not claiming to detect and diagnose cancer. They do, however, have the ability to determine if a patient's signs and symptoms are outside their scope of practice.
Patients will die.
It seems like you're engaging in sensationalism. While not making light of the subject, research has shown that the possibility of one's low back pain being caused by serious pathology is extremely rare. Less than 1% in fact. Could that possibly be why there is no public outcry over seeing a massage therapist at the mall kiosk?
Physical therapists do not possess the skill set of physicians, and they do not have the capability to order lab work and imaging.
Not every patient is in need of lab work and imaging. Just like physicians, physical therapists look for warning signs or so-called red flags from the history and physical examination that would identify those patients in need of procedures like these. Extensive literature reviews have identified 4 key findings with regards to low back pain and cancer. Age over 50, previous history of cancer, unexplained weight loss, and failure of conservative therapy. So in a patient with back pain, who is under 50, without unexplained weight loss, who does not have a history of cancer, and who is responding to treatment, physical therapists can essentially rule cancer out.
The public cannot rely on the history-taking ability of a physical therapist.
Taking a patient history has been part of the culture of physical therapy throughout its history. Are you really questioning their ability to perform this?
A timely X-ray might not be ordered if patient went to a physical therapist directly.
Again, even though physical therapists cannot order radiographs for patients with back pain, current medical guidelines suggest plain radiography should be limited to patients with clinical findings suggestive of systemic disease or trauma. The guidelines are as follows: age over 50, previous history of cancer, unexplained weight loss, fever, trauma, and failure of pain to improve after 4 to 6 weeks. All warning signs that a physical therapist can easily identify and refer to a medical physician.
Direct access to physical therapists threatens the safety of the public.
Again, I ask you, what evidence do you have to back this up? All I hear is sensationalism.
In my 30 years of practice, there have been numerous times where a physical therapist has overlooked a serious pathology. I have other physicians who will also testify.
Dr. Deep Pockets, can you present some documented evidence to back up these claims?
I will bring patients forth, in addition to the physicians.
Dr. Deep Pockets, physicians, just like physical therapists, are well versed in the scientific method and the principles of evidence-based medicine. Peer-reviewed research or documented evidence showing lack of training and public safety risks are both welcomed and perfectly valid. You telling me about your personal experience is not a valid argument against educational curriculums, peer-reviewed research and malpractice claims. Don't you think physical therapists can also make the claim that physicians missed serious pathology and referred patients?
Direct access to physical therapists is a threat to the safety of the public.
Dr. Deep Pockets, you make all these claims, yet you cannot cite any evidence that harm has befallen the public as a result of direct access to physical therapists. You do realize that direct access to physical therapists has been allowed in some states since the 1950s. Presently, about 20 of the states have unrestricted access. A direct access law has never been repealed. Malpractice claims do not increase when direct access laws go into effect. And finally, the largest insurer of physical therapists does not even increase malpractice rates for therapists practicing in direct access states. Is this not evidence of safety?
Nobody sues a physical therapist. They do not have deep pockets. I get sued instead.
Again, that's your personal opinion. Dr. Deep Pockets, direct access to physical therapists has been allowed in the armed forces since the Vietnam War. A recently published article documented 50,000 new patient visits to physical therapists under direct access in the military. Throughout the 40-month data collection period, there were no reported adverse events resulting from the therapist's management.
The diagnostic ability of physical therapists from musculoskeletal injuries is far inferior to physicians.
Actually, research in the U.S. Army refutes your claim. The diagnostic ability of physical therapists for musculoskeletal injuries was found to be better than family practice physicians, internal medicine physicians, pediatric physicians, emergency physicians, podiatrists, physician assistants, and nurse practitioners. Their ability was found to be equal to orthopedic surgeons. Dr. Deep Pockets, I'm becoming bored with you. I'll ask you one more time, do you have any evidence to back up your claims?
Allowing direct access to physical therapists puts the public in grave danger.
Since you provide me no evidence that the public has been harmed, I must question the motive behind your opposition.
My motive has always been protecting the health and safety of the public.
A more accurate motive seems to be the financial threat that you perceive may result from direct access to physical therapists. You do realize that there is no evidence that direct access has a negative financial impact on physicians. It appears that under the veil of trying to protect the public, you have done nothing more than protecting your own financial interest at a cost to patients. If you cannot provide evidence of public safety risks, then a patient should not have to pay you for the privilege to see a physical therapist. What is your closing statement?
The fact of the matter is I don't have to provide any evidence. The medical profession is well established, highly organized, and highly funded. We donate to political campaigns and influence many decisions. Legislators fear losing our support and vote accordingly. Most of the time we can stop a bill from even leaving committee. Sorry, physical therapists, we can play politics. Life is not fair, deep pockets will win.
Dr. Deep Pockets, you are a tool, but unfortunately you are absolutely correct. Physical therapists, despite overwhelming evidence in your favor, you will never pass a law as long as you remain unorganized and unfunded. Common sense does not win out. I challenge every physical therapist to go out and get involved with the American Physical Therapy Association, as well as contact your state legislator regarding direct access to physical therapists. Also, ask your patients for support. Let the public know you exist. Finally, a message for students and recent graduates. You, unlike your predecessors, are bearing the brunt of Vision 2020. Those before you never had six-figure debts from doctoral-level courses. You have been trained to practice without referral, yet often cannot do so. That is why it is imperative that you become involved if you want your voice heard. The therapist who graduated 20 years ago just does not have as much at stake. As an example, they bought Google at $100, you were late to the game and paid $500. Get involved. Challenge your professors as well. What are they doing on your behalf? They certainly accept your tuition. The real world is not nice. Sometimes you have to ruffle feathers. If someone makes unfounded claims against direct access to physical therapists, don't let that go unchecked. Call them out. Let it be known what ludicrous claims they are making. When actions have consequences, they will stop. With that, I close. Go out and make Vision 2020 a reality.